Hi everybody, my name is Alina. Welcome to my channel if you're new here. Today's a very exciting day because I'll be doing a laser treatment. So we came out here with Benji to take a walk because after my treatment I won't be spending much time outside. You want to avoid sun exposure, so I will be inside all day, so I decided to come out and take a walk and also film the intro to this video. If you don't already know, I am a registered nurse and I work in aesthetics, so I actually do these laser treatments on a daily basis for patients, and I'm excited because I'm going to be getting mine today. The laser that I'm getting is called the DOT, D-O-T, which stands for Dermal Optical Thermolysis. The laser I'll be getting is a fractional CO2 laser, which means that it only treats a fraction of the skin, making it a lot less downtime, first off, but also a lot less risky. For me, my concerns are after I break out, I do have hyperpigmentation, which is referred to as PIH, post-inflammatory hyperpigmentation. So it leaves little spots on my skin where the breakout was, and it takes months and months for those spots to go away. If it was a cystic pimple, it'll take even longer for it to go away. So those who break out, you know what I'm talking about, where that spot just stays around and lingers. The DOT laser that I'll be getting will help to lighten those acne scars. And it'll be a process. It'll take about 2 months to really start seeing the results, and it'll continue to improve within 4 to 6 months. But in general, the reason why it's so beneficial for pigmentation, scarring, or even sun damage is because it causes a sloughing process. Sloughing process, it's not a peeling, but what you feel is this rough texture on your skin. It feels kind of like sandpaper-like texture. You do get a more even, radiant tone of the skin. It also stimulates collagen. Collagen is a protein that holds our skin strong. So by stimulating collagen and elastin, it's going to help with fine lines and wrinkles. I've had this treatment done before. I really noticed the softening appearance around my mouth as well as around the eyes. There are a lot of different settings that I choose when I do this laser for my patients. I can decide how close the dots are together, meaning the penetration points are. So the closer they are together, the more amount of surface that we're covering, so the stronger the treatment. I can also adjust the heat and the depth of how deep the penetration and how long the heat will continue to penetrate in the skin, and also the actual temperature of the heat as well. So I like to do a very subtle treatment. So what you'll see in this vlog as my healing process continues will definitely be different than if you ended up going and getting this treatment done and you have certain concerns that we're trying to treat. We'll probably do a much deeper setting than I'm doing for myself. So my downtime will be much less, but I'll take you through that process. We can do a follow-up in a couple months so you can see some of the results that I'm achieving. I'm having my girl Shondell do the treatment for me. She's also one of the nurses. I will put on a numbing cream just to help take a little bit of the edge off. You do feel heat sensation and little prickles, especially on sensitive areas like around the mouth, but overall it's tolerable and actually a very fast treatment. All right, so let's take a close-up of the skin. Okay, so I don't have any makeup on now. I actually just had a little whitehead there, so it's a bit red. I really don't suggest doing this treatment if you are actively breaking out. I suffered from acne years ago, and you can see my video on certain tips that I give that really helped to treat my acne, but I do still have some scarring left over, as well as some pigmentation because I was definitely loving the sun when I was in high school. You can see on this side of my skin I do have some pigmentation. I have little freckles. I like them. I don't mind if the freckles lighten or not, but I had a recent one that left a scar behind there, so I'm hoping that will lighten. I'm excited to show you the process. I bought us some smoothies and I added chia seeds and spinach, so there's a little bit of protein. Otherwise, most of this smoothie is just fruits and super seed avocado toast. Ooh, I'm excited. I got this for me and for the nurse that's going to be doing my treatment. Ooh. We had just taken photos with a 3D camera, so it creates a 3-dimensional photo of the face, so you can turn it around. So now I'll be numbing. I'm gonna do face, neck, and a little bit of the chest as well. So it is very important that you do not expose to light. So I am closing all of my windows because UVA rays can penetrate through the windows. Hello, it is 2 hours later. Everything is going really well. I iced some of the areas that kind of stung a bit. So now I just look like I've had a sunburn. Things that you can do is you can take a towel and wet it, put it in the refrigerator, make it nice and cool, and then you can lay it all over the skin. It'll feel really nice to do that. You can also take a clean spray bottle, fill it with water, preferably distilled water, but clean water, and then put it in the refrigerator. And then throughout the day, just mist the water. Another quick tip is if you have hydration in the skin, like if your skin is already moist, then apply your moisturizer because it will help to hold on to the moisture for a longer period of time. What I'm gonna do is just sprinkle my face with water. This is cold water. Feels amazing. I don't have a spray bottle, but the skin is definitely considered dehydrated at this point. So because of the dehydration process, you definitely want to have moisture on it. Then I'm gonna go ahead and reapply the moisturizer. And it's nice because it glides so much more smooth and even. Now I have mascara on, so I'm gonna have to be very, very gentle when I take that mascara off. Make sure I don't rub the eyes because we did treat under the eyes, and usually when you get your treatment done, at least at our office, we're going to treat under the eyebrow just a little bit, and pretty close to under the eyes as well. So you want something with no oils. You want to change your pillowcases and all your face towels, clean all your makeup brushes, making sure everything's nice and clean for your fresh skin once it's healed. Make sure during the healing process that you're drinking lots of water. Hello, good morning. Hello, good morning. Hello, good morning. It is the next day. Now with my patients who come into the office to get this treatment done and get a moderate to high laser treatment done, then today, the next day after your laser treatment, most likely you're gonna have swelling and redness on the skin. So this is gonna be your most downtime day. Because the settings that I had used were lower settings, I pretty much have half of the downtime that you usually would. And so now my skin is starting to go through the sloughing process, meaning it's starting to feel rough texture. You're seeing all the little dots on the skin, and the sloughing process that my skin is experiencing now is something you'll be experiencing about day 3 or day 4. Still such a great treatment, even if you don't do the deepest setting. So it is about 5 o'clock, the sun is going down, and I'm really not liking my moisturizer at this stage of healing. I feel like my skin is very tight and dry, and it's a little bit tender and sensitive, especially in the neck. Rather than having to go outside, a few hours ago, I ordered from Target, and Target will deliver straight to your door, contactless, and I ordered a new moisturizer. So I'm gonna change my moisturizer to the CeraVe moisturizer, which is usually what I recommend for patients, but I didn't have at home, so I used that Bioderma one. But I do really like CeraVe. I'm just waiting for it to be delivered. Otherwise, the skin looks really good. My biggest recommendation is to make sure that you don't touch anything. I have to remind myself not to touch my face or not to scratch an area that might feel itchy. It's also very important that while the skin is going through the sloughing process, that you don't pick or exfoliate all those dead skin cells. Let them fall off on their own. Preferably don't even touch the skin. And be careful that you're not using an abrasive washcloth, no Clarisonic type of spinning brushes, and no cleansers that have little beads or particles that can physically exfoliate the skin. And then you also don't want to chemically exfoliate the skin, so any glycolic acid, lactic acid, salicylic acid, all these chemical exfoliants, including retinol, not sure if I mentioned that, but retinol will definitely make your skin a lot more irritated and sensitive, so don't use any of those. Another point I didn't mention is that you don't have to use Vaseline during this healing process. Vaseline can actually be a little too thick, and for those like me who are acne prone, could cause little comedones, which are little clogged pores underneath the skin. So no need to use any Vaseline, just a regular moisturizer, preferably one that's for dry skin. Lastly, I do have to mention my sweet Benji, our border collie puppy. He loves to give kisses. He's very cuddly, so I have to make sure that he's out of this area. He can scratch me by accident, or he does have, he carries some dirt, bacteria, and things are open, so it can get in, possibly infect, who knows. Another thing is I haven't been near steam, so I don't wash the dishes with hot water, and I'm also hanging out in an environment that has more humidity. So we're in our second floor home, and so there's a lot more humidity in this room, so I'm just hanging out in here and doing some self-care. Try not to focus on your skin too much, because you could get a little bit of anxiety if you see your skin looking worse than it did before during the healing process. It kind of messes with your mind. All right, well, I'm gonna say goodnight for now, and we'll see how the skin looks tomorrow. Hello, good morning. So it is day 3 after the laser treatment, and I thought I was sloughing yesterday, but I'm actually sloughing a lot more today. When I touched the skin, when I washed it this morning, it felt a lot more rough texture. So I'm still going through the healing process. It's not completed. Hello, so it is day 7. It is my 1-week mark after my DOT laser treatment, and I would say that my face is about 90% healed, where I do still feel on the sides and on the forehead and on the jawline some of that rough texture, some of those dots, and on my chest as well. The chest probably has another 2 to 3 days of the sloughing process. Otherwise, the skin looks really good, glowy. It's very important to protect it now, and I'm wearing sunscreen on it. I also just remembered I wanted to mention that I'll be resuming my normal skincare in about 3 days. I'm still gonna wait until the sloughing process completes everywhere before I go back to my vitamin C serum and my moisturizer, which has a little bit of salicylic acid, which is a chemical exfoliant. So I wanted to add that in there because a lot of patients ask me, when can I go back to my regular skincare routine? Now I'm wrapping this vlog up. I'll see you in my next video. Bye!